Are you interested in opening up a dry eye clinic? Do you want to have a referral center? Do you love dry eye? Do you have patients that come through your door every single day, but you're a little lost in the sauce and don't know how to treat them? Well, guess what, friends and family? I have a colleague here that's going to take it to the next level, that's going to break it down for us on today's show. Friends and family, tap in as we jump into the wonderful world of Defocus Media. Let's go. This is a Defocus Media production. What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus. What's up, everyone? It's your favorite optometrist, Dr. Darryl Glover. Super excited to be here. It has been a journey to get on a call with the one and only Dr. Kristen Brown. How are you doing today?
I'm doing great, Dr. Glover. How are you?
I'm doing well. We were a little late to the show because we were having a pre-party. We both had some issues, technical issues, but we're here. We're in the flesh, at least virtually, and we're going to make some magic happen. And I'm super excited because today we're going to talk about something that's really impacted everyone that's an eye care professional, but not just everyone that's an eye care professional. I say it's impacted everyone that's in the world, to be honest with you, and that's dry eye. And I think as eye care professionals, Dr. Brown, we really got to do a better job of serving our patients. And I feel like if we can't handle what's in front of us, we need to set up our patients with someone that can handle it for us, right? Because as eye care professionals, we're a team, we're a unit, we're a family. And together we can make a bigger impact and change lives forever. Before we get started talking about, dry eye and, how to build a co-management center and how to elevate patient care, I'd love for you to maybe share a little bit about your background, how you got into the world of eye care, where you went to school. And we love fun facts. So if you don't mind sharing one of those, that'll be fantastic. But let's break it down from the top. What's the story of Dr. Kristen Brown?
Sure. Well, I'm a California native. I grew up on the West Coast and went to undergrad as well as optometry in Northern California. And from there, I thought, what's the furthest I can go? And, I thought, all right, well, East Coast, right? So for residency, I headed out to Boston area and spent a year there. I wanted to learn more about ocular disease, but I also wanted just an adventure. And that was about as far as I could go and still be on a coastline. So that brought me, many, many years ago, a little over 30 years ago now, to the Boston area. And after that residency, I thought, well, now what, right? I got all this great knowledge and passion for dealing with eye disease. And so, back then, I think it was Optometry Times was delivered to you as a newsprint. So perusing the job opportunities and happened to come across a fellowship in ocular disease. And I thought, well, what else am I going to do? I could stick around. I could head back to the West Coast. So that was an opportunity really that set, kind of the foundation for my career and really all the ways that I wanted to practice stem from that 2-year experience back on the West Coast. But probably a fun fact in all of that was I hadn't even intended on going to college. I actually was an athlete and had an opportunity. My coach came to me and said, what are you going to go to college? And I was like, I don't know. And so she said, well, if you could do this, would you go? And I said, sure, sign me up. And so it was really a journey of realizing that there's a lot of different ways to be smart. There's a lot of different ways to, follow your interest. And I have been incredibly fortunate for my entire career.
I love it. And, we're blessed to have you to be a part of this amazing profession, right? Because you're doing things that are next level. And I really want to break that down, but I think it's only right to really talk about, how did you even get into the concept of co-management, right? Because, this is something that's discussed in school, but not a lot of time is spent on that concept or that way of practicing. And, I really want to dive deep into this co-management center that you've created, or that your partnership with Eyewell. But I think we have to take it from the beginning. So let's talk about co-management. How did that even come about? And why is that important, especially when it comes to OD to OMD, optometrist to ophthalmologist? Because I feel like, that's a conversation that we really have to set the foundation here.
Sure. Well, the word gets thrown about a lot, and I think there can be different definitions. And so, what I mean by co-management is collaboration. And with
Mm,
collaboration, I think of, the back and forth, right? We can
yeah,
refer patients on for surgery. We can refer patients for retina where it's beyond our scope or our ability to really manage that patient. But we often don't think, well, what's next? When does that patient come back, right? And
right.
so a handoff, but there isn't necessarily the expectation or even the coordination of that care to come back to us as our, patient's primary eye care provider. And so in that fellowship out on the West Coast, it was truly a co-management model where it was a large group of MDs and ODs, ophthalmologists and optometrists, and each of us did what we were good at. And
Okay.
so surgeons did surgery, and the optometrists really co-managed and communicated and collaborated with other optometrists that would refer patients to us. And so we were that liaison essentially to that center and that surgeon, and we ensured that that care and that patient got back to their referring eye doctor. And so, the piece that often is missing, as I mentioned earlier, is that sort of we refer these patients on and then we go on to the next patient. And so for real co-management to occur, it doesn't matter if it's between an ophthalmologist and an optometrist, if it's between a primary care physician and an optometrist. It's really about, the communication and the priority being that relationship. Yeah, we're absolutely going to, provide excellent care for that patient in our chair.
Yeah.
But the priority is the relationship with that doctor.
Yeah. No, I love it. And I love the word collaboration. I think that might be the buzzword for today, because collaboration is king, right? Especially if it's done in the right way. And that's what I really want to, break down today is the collaboration that you have created with the masses, whether it's optometrists, ophthalmologists, rheumatologists. And I really want to get started with understanding the concept of Eyewell. How did this, populate? How did it come about? And just kind of give us a good overview of what this is all about, if you don't mind,
Sure.
Kristen.
So Eyewell is essentially a core dry eye facility. That is all we do. We don't provide routine care, comprehensive care. We don't do glasses. We don't do optical. We just do dry eye. And the concept came about 5 years ago. My business partners, Amy Now and Andrew McLeod, had been practicing in the legend Don Korb practice in Boston, Korb and Associates. And, they came up with this idea, they see a lot of patients that are referred to them by our optometrists, or patients will find them who've been cared for by other eye doctors. And those patients are frustrated. They're on traditional therapies. They're still progressing. And so this concept really came from some of the dry eye care and the research from this Don Korb dry eye practice in the Boston area. And kind of the right time in the right place, I happened to reach out to those colleagues and said, I'm looking for something new and different and to get back to what I love doing and, what I'm passionate about. And, having come from 25 years of overseeing a refractive surgery cataract practice in the Boston area, I saw not only dry eye that was exacerbated by LASIK and cataract surgery, but a lot of dry eye that came in the door before the patient had surgery. So these patients were underdiagnosed and undermanaged, not because their eye doctors weren't smart or capable or competent, but, symptoms, vary a lot with dry eye. And so, these patients wanted to get out of their contact lenses. They wanted to have surgery. And, we didn't have the tools. We didn't have the diagnostic or even the therapeutic tools that we have, really only 5-10 years later to manage these cases. We just didn't have it back then. And so, I felt my hands were tied. And so when I thought, what do I want to get back to? What do I love doing? I reached out to my business partners. I said, I would like to join you in the Don Korb legend, dry eye practice. And they said, well, that's great. We have an idea for you. And
Okay.
they presented this idea of Eyewell to me. They had been working on it for 4 years. They had come up with the name. They had come up with the business model. And I thought, oh my gosh, that's perfect. And they knew my background in co-management of refractive and cataract surgery. So it really just was a meeting of the minds in the right time and the right place. And, sometimes one of the hardest things to do is move on. When you're in a situation where you love what you're doing, but you're not necessarily as passionate about it as you might be. And so, it was tough to walk away from what I was doing at the moment. But I thought, why not? It's the end of,
Yeah.
last 10, 20 years in my career. Why not just start a business?
Yeah, I love it. And that was one of the things I was going to ask you was what were some of the biggest challenges? And clearly, leaving from something that you're familiar with and starting something new is always a challenge, right? It makes you sick to your stomach. You think about it, you don't sleep at night, you're like, what if this doesn't work? But also, what if it does work? And what if
What if
it's
it
more
does?
successful than what I've been doing before? And what if I like it even more, right? And I think this is what's cooking up with you and what you guys have been doing and the impact that you have been making. Now, what I'd like to touch on just a little bit, because there's a young OD out there that's looking at this live stream or listening to this stream or this on podcasts, and they're like, "Man, I want to start this, but I don't know what hurdles are out there from a business standpoint, from a logistics standpoint, to open up a co-management center." So if you don't mind maybe spending a couple minutes or whatever amount of time you like to just really discussing some of those hurdles. Because for me, just high level, I'm thinking equipment, 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 and marketing, 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 and building those relationships will be probably some of the hurdles I would think of off the top of my head. But I'd love for you to
They're
share.
really, I mean, they're absolutely the top three, and resources, right? So when I think
Mm,
of resources, I think capital investment for sure. We have calculated that it's between 500 and $750,000 to really launch a comprehensive eye care center with
wow.
super. Right. And so one of the things we're committed to is really addressing this from, every angle. When patients come in, they've been on other therapies, they've been on the topical pharmaceuticals, they're still progressing, they're frustrated. It's because not all of the contributors to the problem have been addressed. So in order to really do that, you have to be committed to people resources, technology resources, and the biggest one, which is time. And none of us get to carve out any more time. And we're already stretched for time, right? We're already
Right,
doing things that we either love doing. Maybe we're focused on myopia management. Maybe we're focused on, specialty contact lenses, fitting keratoconus. It could be a couple of different things, but
sure.
none of us have more time in the day, and none of us want to be doing charts beyond the time we're already doing after hours, right? And so, I think the biggest challenge that my colleagues, my optometric colleagues that I've seen go this direction have found is they get started, they get a device, and they start treating dry eye. But this is so complex and so multifactorial that, it's not a one size fits all.
Right,
$100,000 for IPL technology, that's great. But what if it's not ocular rosacea? What if it's something else, right? What if the contributor is not related to ocular rosacea, right? And so, a lot of patients we see, they get put on plugs and doxycycline. Well, do we know if that patient had inflammation? What are we really addressing? So making that commitment, number one, that you're going to do it, have the capital, investment. That's kind of not that hard. It's expensive, yes, but it's really about making that commitment. And that's where I see sort of docs stop short. It's sort of like they get one or two things, and then, that's what they do. And it could be MDs or ODs. I am not
yeah,
criticizing anyone here. It is complex and it's challenging, and it's where I found myself, 5+ years ago. And so it's really constantly learning and understanding. It's carving out that time. And so we've really simplified things. We created a model where, you know, if this is all that we do, these patients are looking to be heard, and they're looking for the time, for someone to really sit and listen, and then investigate and be very problem specific. I remember being in school 30 years ago, where being evidence-based was so important. Do we even have the time to do that nowadays? you know, Reimbursements what they are with, managed care, it's really challenging. And so we chose to go a route that, is more efficient, because we are not dealing with managed care. We are simply
Oh,
self-pay. And most of what we do within dry eye therapy these days is not covered anyway. And so we thought, let's just go 100% that route. We help patients with itemized receipts if they would like to then spend their time submitting to their insurance for reimbursements. Maybe they will be successful. We tease out the doctor's time versus the treatment on the device. And so in that way, we're really kind of skipping through some of the red tape. Patients don't need a
yeah,
referral from a primary care provider. We do want to co-manage with their eye care provider, but
sure.
patients can schedule directly with us as well.
I love that. And, one of my questions was going to be, is this lucrative? How are you dealing with insurance, right? Because I know that can sometimes, pop your hand, right? And it doesn't always allow you to do what you really need to do, which is sad to say, right? I mean, you still do what you got to do, but, even when it comes to getting medications, I send a patient to the pharmacy and they come back and they're like, Dr. Glover, it's $1 million. There's no way in hell I'm paying for that. I got to pay for this monthly, and I'm looking at the math, and 12 months of this in a year equal, and I'm just like, my head is spinning. I just don't have the time to even sit down and process those things. And the same thing when it comes to certain testing in the exam lane as well. Now, what I would like to dive into next is really the journey of the patient, right?
Sure.
I'm Darryl Glover. I have dry eyes. They're burning, they're watering. My doctor referred me to the famous Dr. Kristen Brown, and I'm in your front of your office, right? I'm sitting there, I walk in and I talk to your front desk person. Kind of walk me through what that patient journey looks like, because it sounds like this is a beautiful office and there's a lot of bells and whistles, and the journey's a little different from what I would do in my practice for dry eye.
Well, and I would even rewind a little bit, because the
Okay.
journey begins before we even meet. And the way that happens is we have created intake forms that the patient will receive via email as soon as they book their appointment. Part of that intake form is saying yes to receiving emails from us. So we're getting permission to do that in
Sure.
advance. And with that intake form, they can fill it out online. They can fill it out on their phone if they like. And essentially, it goes through all the things that we want to know about them. We want to know, what have you tried? Where have you been? Who prescribed what? What's working? What's not working?
Yeah.
When they're in front of me, then a good chunk of that time is spent having a conversation about all of those contributors. Not, which treatments did you already have? That's information we've already gathered, but it's really understanding, tell me about, how much screen time do you have? When did you start wearing contact lenses? How many hours a day? What autoimmune or systemic conditions do you have? What's your diet like? Plant-based on one end, ultra high processed foods on the other. You know, did you ever smoke? So really looking at all of the contributors, what are their medications? So a lot of that information we aim to collect in advance. And so that's a matter of myself or my colleagues, my business partners, taking a look at that history and being prepared when that patient comes in to really kind of hone, okay, help me understand, what do you notice when you had that thing done or when you tried that topical pharmaceutical?
Well, before
And
you go
so
further with this journey, I'm curious to know, are you also giving them some type of dry eye questionnaire with that intake
it's
form?
basically that intake form, right? So it's
Okay.
understanding what their symptoms are, what are
Okay.
your symptoms,
So it's your own, you made up kind of your own, or are you using a speed or DEQ, or like what are you using for that?
sure. So we do. I mean, we do a speed survey as well. So that's part of the intake, and
Gotcha.
that's so, but it is more than that, right? And
Yeah.
so
More detailed.
mhm. So
Gotcha.
it's in addition to that, and so um, again, whether they found us online or through, a friend, or whether they were referred by their eye doctor. If they've been referred by their eye doctor, I'm going to reach out to that doc, or that doc's going to have already reached out to me and say,
Yeah.
I'm sending you my patient. Here's their history. They're going to send me some information, so I have that as part of the patient's medical record. And then I'm not going to repeat any of that. I don't do what their eye doctor does, right?
Right.
If the eye doctor does IPL, but they're referring that patient to us because they want a more comprehensive evaluation, I'm not going to offer that patient IPL at Eyewell, even though we do that. That's understanding that relationship with that
Yeah.
partner of Eyewell, is say, you know what, I think IPL is a great option. Or they would have already done that, and now they're looking for something different. And so, it's Eyewell understanding who our partners are and, where they leave off and we can pick up.
I love that. I love that. And that goes back to our buzzword for the show, collaboration. The only way you can have collaboration is by building trust. And you're creating that trust with your colleagues saying, hey, I'm going to do what's right for this patient. I'm not going to duplicate what you've already done. And if you have a product or service in your office and I have it, I'm going to send them back and let you continue doing what you need to do. But I'm going to get to the bottom line of why this dry eye is here. And we're going to collaborate and build together. But that all starts with trust. And I love how you're doing that from the front end so that the doctors will understand that you're here for that patient to make sure that they're happy with the glasses or contacts that that doctor prescribes. Because at the end of the day, if the eyes are dry, you're not going to see as clearly. The contacts aren't going to feel as comfortable. And some folks, their life is miserable. So I'm loving this. So let's continue with that patient journey.
It's a huge quality of life issue, right? And so, part of this business model that my business partners came up with was, the fact that we have to lower the barriers to partnering with our optometry friends, our ophthalmology friends, our rheumatology, dermatology. So if we are prescribing glasses, well, you know what, we're doing what our colleagues do, and that's competitive, and we don't need to do that. And so when we see patients and they love the kind of care that they're given, particularly if they don't have an eye doctor, I've had patients say to me, I'd love to come back here for everything. Like, I would love to see you for everything, but we don't do that here. So let
Yeah.
me find, one of our partnering eye doctors that I can refer you to, so that really that relationship goes back and forth.
Yeah. Love it. I love it. I love it. So essentially, they get the intake form online before they walk in. I walk in. You've already kind of reviewed the chart. I'm assuming a technician comes and gets the patient, and then from there, they do some additional testing prior to going in.
Oh, correct. So testing involves, everything from, tear film analyses, osmolarity, MMP9. They're going to get meibography, upper and lower lids. They're going to, what else are we doing? So depending on whether that patient is there for a dry eye eval or extensive dry eye eval, I'm going to step in and we're going to do corneal sensitivity testing. We're going to test for
Oh, wow.
hyperplasia. We're going to do vital dye testing. We're going to look for a poor lid seal, core blacky light test. So we're really doing a lot of diagnostic testing in a fairly, rapid fashion. But with the data that I'm provided, I like to sit down first and chat with the patient and just, they want to be heard, and it's
Yeah.
amazing how
Especially dry eye patients, though. If you
they've
can
been
sit
through a
down
lot.
and allocate X amount of time to just listen, a lot of times you can figure out what the problem is by just listening to a patient. That's not just dry eye, that's anything. But with dry eye, especially, you got to allocate a little bit more time to hear that patient out. What do they do for a living? How are they using their eyes? What are their hobbies? What are they experiencing that discomfort, that foreign body sensation? Do they travel a lot? Does their significant other like to sleep with the fan on and they don't like to stop? Like the list goes on and on.
Well, and
So
and
I love
even
that.
when are their symptoms worse,
Yeah.
right? Are they waking up with it? Is it at the end of the day? Is it any time of day? What is their pain level? Is it, a lot of our patients, they might say on a scale of 0 to 10 that pain or that discomfort is a 1, which sounds like, what's the big deal? But it is a nagging,
Yeah.
constant, it's a quality of life issue. And what they're really looking for is to not constantly be thinking about their eyes. Some are in fear of going blind, and of course, it's nice to be able to reassure them that that's probably not going to happen here. Uh, So it's really about using phrases and hearing what they're saying, like you said, and having kind of a little bit of a running tally in my mind. You've done that, didn't work, you tried that, you got the most benefit from. The other thing is educating patients, and it's being very problem specific about what they've done or not done, what I'm seeing, and what they're telling us, right? And so if we're measuring elevated inflammation, that's great. Let's treat it with an anti-inflammatory. But some of these people have been on medications for years, or there isn't elevated inflammation, and yet insurance is dictating that I prescribe an anti-inflammatory before I can prescribe anything else. So it's really trying to find, navigating all of the challenges and really dealing with all of the contributors. Otherwise, these patients are going to progress. They're going to be frustrated, and they generally are going to come find us, which is what tends to happen.
Wow. And I love it. I'm glad that you guys are there to be able to take care of these patients. It sounds like you're spending a great amount of time with them. I'm curious, what does the journey look like inside that exam lane after you build that relationship and that trust, and you and the patient are now collaborating? It sounds like you may be up to like 30 minutes, 40 minutes in the exam lane, right?
Oh,
Because I mean, that's a lot that's taking place there. So I'm curious to know, what time do you allot for those conversations in that patient care?
sure. Well, the testing can be fairly quick, when you've, done it and kind of, gotten your routine down, but
Yeah.
they're typically 45-minute visits. We try to do as much as we can before the patient gets there in terms of understanding. The history is really the most lengthy. And then it's
Gotcha.
really about, coming to a fairly quick, conclusion. What are the things that are contributing, and listing them with the patient. What I often find myself doing is saying, what, I here are the 3, 4 things that I'm seeing. Here's what we recommend. There's short term, and then there's long term. There's
Okay.
in-office procedures, and then there's at-home maintenance. And, think of this like the dental model, which we've all started using, which is really about, you wouldn't wait until you had gum disease to go see the dentist on a regular basis. Once there's gum disease, it is a lot harder to get on top of that, right? And you're going to need to go more often. So if somebody has moderate to severe dry eye, this isn't a, gee, take your Restasis. Sorry, maybe I shouldn't have said a name out loud, but, take your topical treatment and do your warm compresses and you're good to go. No, this is, we're going to need to see you on a 4 to 6 month basis. We're going to recommend, getting certain treatments on a regular basis, because you just wouldn't take your diabetes medication for 3 months and think, okay, I'm cool. No, there
Right.
are daily fluctuations, there are seasonal fluctuations. And so it's an ongoing maintenance. And it is the most frustrating aspect about it to patients. And I love when they come in and they, the 25-year-old who has, 50% atrophy of their meibomian glands. And, you show them pictures and they say, how come all of a sudden? It's like, well, this didn't just start yesterday, and they want to pinpoint it to, oh, I had that viral conjunctivitis a month ago.
Yeah. That's a
The
common thing.
contributors are always occurring, and it's a growing problem. I mean, we're really seeing just dramatic increase in younger people, which when I went to school, I thought dry eye was the most boring thing. It's like artificial tears. I don't even think I learned about my meibomian glands in school. It was that
Yeah.
long ago.
Well, look, all great information. I have to ask you, with you having this amazing dry eye practice, co-management center, what are all the bells and whistles, all the tools, all the toys that you have in the practice? Because every time I go to Vision Expo or some conference, I'm just like, wow, the technology gets better and better. So I'm curious to know what you get to play around with every day. I'm about to live through you over the next 30 seconds to a minute or so. So I'm curious to know, what are we playing
Sure.
with?
So of course we have intense pulse light, and again, one size doesn't fit all, but we have devices for thermal expression, and I love that. I do a lot of expressing. We have devices for exfoliating the lid margins and reducing biofilm. We can prescribe anything, of course, that's within our scope of practice and formulary. And so whether that's topical steroids, the newest, pharmaceuticals that are approved out there. But the in-office devices are really the ones where, it's about melting that meibum and expressing it from the glands, opening up those glands and keeping them active, right? And so I'm happy to name names if you like, brands, but
No, it's okay. I think what you did is perfectly
sure.
okay. That maybe that could be another podcast, and we bring on one of their partners,
Sure.
and we can
I
get
mean,
into
my
it,
favorites
right?
really are about, the assessment and understanding, so we have a device that Don Korb created, which is really about tear film analyses and understanding partial blinks. I mean, that is the biggest contributor to dry eye in young people, right? They're staring at screens. The ones that are the most challenging are the young folks that are gaming, right? I've had patients say to me, and it's reversed their progress because I started a new game and I'm forcing myself not to blink, because that's how I win that shooting game. It's like, okay,
Yeah.
I don't know how to get you to stop doing that, but everything in moderation. And so, computer screens, when we can show that patient a video of their incomplete blink and they're not getting that mechanical pull of meibum from the gland, it's a bit illuminating for that patient to say, oh my gosh, that's my eyes. I had no idea.
Yeah.
You can't tell when you're not blinking all the way. And we see
Yeah.
it at the slit lamp, but that's one of my favorite tools, is a device that can measure that.
I love that. And what I'm a little nervous about is the next thing we're going to see on TikTok is a new challenge of not blinking,
Oh,
right?
well, we're going to be doing some marketing on social media where we're going to show them what that is. So
It's no, I'm telling you, it's probably already in rotation right now. We just haven't seen it yet, because that's a great point. I never thought about that, because, gaming, that's $1 billion industry. I mean, there's people that, game. And from my understanding, I was listening to a podcast the other day and they were talking about Epic Games, and they were talking about how many people watch the games just on YouTube.
wow.
And the amount of people that watch it, it's crazy. It's more than the people that actually watch, well, I think that play the games or something like that. I can't remember the exact detail, but a lot of people watch the games, which means they're not blinking, right? Or they have those partial blinks as well, which is going to equate to drier eyes, right? So a lot of opportunity, a lot of patience. I'm curious, with this, short term, long term, with the surgical option, with all the bells and whistles that you have in the practice, are you a firm believer of also having products in practice to be able to sell to patients, such as artificial tears, various masks, and things like that? Vitamins, is that something that you guys look at? And do you find that's lucrative as well?
Well, I think it's important, right? And of course, we're not doing this, out of the goodness of our heart. It is a business. We
It's a
want to be
business.
we want to be successful, and
Yeah.
we want to earn a living, and we want to be highly successful. So yes, product is important. You have to weigh having product and space for that versus having an online store. So we have a little
Sure.
bit of both. One of the other, I think, important products to talk to our patients about are, in a general sense, the idea of clean cosmetics, because what they're not realizing is how much the preservatives in either eye makeup or even just skincare products. And this is really men and women. I have young men who are applying retinol directly over the meibomian glands. There's research showing, how that is toxic to meibomian glands, at least in vitro. But we need to help them understand which of those products are toxic to the skin, the glands, and really are contributing to dry eyes. So whether it's makeup, skincare products, or even treatment for acne. This is why we partner with dermatologists. They're putting patients on Accutane, which is really wreaking havoc with many of our young patients, meibomian glands. So I've seen some really interesting, when they go off it, when they start it, it's really effective at the
Yeah.
sebation glands. So yeah,
Yeah.
really having products that are that have fewer toxic, preservatives, or are less toxic to the eyes and less likely to contribute to dry eye.
I love it. I love it. And I want to continue that conversation about the collaboration with other healthcare disciplinaries, but I want to put it on the back burner right quick. I want to take it back to the front surface of the eyes, but in particular, I want to talk about lashes. Uh, you know, a lot of my patients are ladies, and some come in with lashes that, as soon as I walk in the room, they smack me in the face. And, others, I look at them and I'm like, wow, these are flawless. I didn't even know these were false lashes, right? They look perfect. But, as a eye care professional, as an optometrist, as a man, I get a little lost in the sauce in regards to, educating the proper way to clean the lashes. And I'm really a little lost in the sauce when it comes to their technician telling them what to use to clean the lashes. I mean, the products that they're being educated to use, are those good products, or should we be educating our patients something else to use?
Yeah, well, it's a really big can of worms, right? And
It's a loaded question, I know, but
when you've had to it's amazing to me, again, when you're prepping a patient for LASIK, and they're sure that they didn't apply makeup that morning, but boy, did it have residue, and they're shocked. They really don't see it. They
yeah,
do not see at the level of detail that we do. And so it's, I think, taking pictures of
yes,
those lashes and the glues and the buildup, the debris. I mean, eyelash glue, makeup, mascara on top of it, Demodex on top of that. I mean, there is nothing more alarming when you can show a patient what that looks like up close, because they
yes,
don't see it. And so that's motivating, and it helped them understand that, this is contributing to the problem. So, it's important to do it without judgment, and I take the approach like, here's what I see. I realize you may not be able to see it at this detail, but here's where this is an issue. So, I'm not against women, men, anybody wearing makeup, eye makeup, but remove it at the end of the
yeah,
day. Here's some products, whether it's Credo, Eyes Are the Story. There's some great products out there that have makeup removers. It's tough. I have a personal bias against the eyelash extensions, because I've been more on the side of having to talk a patient into, removing them or getting them clean before they have LASIK than I have been a fan of them. But it
yeah,
is a tough conversation. But again, I think photographs, if you have a slit lamp camera, that's the best thing you can do is show them, or
yeah. I
show
mean,
them someone else's, from a book, from a magazine, whatever, what that looks like, from a journal. And this is what your lashes look like. This isn't you, but this is what it looks like.
yeah,
But, we can talk a lot, and there's nothing that's going to derail our patients' success in dry eye management than their own behaviors. And so, we just have to keep reminding them, maybe that's sort of the good and the bad. It's going to keep us in business. None of us are going to stop staring at screens. And so we just need to continue to point out how that problem is, how what they're doing is contributing to the problem.
figure out if someone wants to partner with you guys in regards to maybe, franchising this out. I don't know if that's something that you guys are looking at doing. If you don't mind, maybe spending a few minutes just really breaking that down, because I know there's a lot of folks out there that's interested in, taking their dry eye practice to the next level, or on the verge of opening something, but don't really know the blueprint of what they're supposed to do. So if you don't mind, maybe spending a little bit of time just breaking that down.
Absolutely. Well, we are very much interested in scaling the concept, and whether we call it a franchise or otherwise, we want to partner with our optometric colleagues, ophthalmologists, again, not so much in the co-management sense, but in the business practice sense. And so we would like to have an Eyewell in multiple cities. We would, like to be careful in our approach and work with the right docs who have a network that they can, develop and work on. But, we're happy to, have that conversation first and explore, what that looks like. Obviously, you want to be somewhere where you can, collaborate with colleagues in the area. So one of the biggest challenges we see is a doc who wants to get involved in dry eye, but they just don't have the volume of patients to justify it. If they've got relationships and they're trusted and they have credibility among their peers in their area, that's a great starting point. And so we're open to having those conversations. I had a woman reach out to me from London, not too long ago, and she is just so excited to create that Eyewell model, whether it's truly an Eyewell or something else. But we're, you know, it's a business model that has been worked on for a long time, and there's a lot of expertise that's gone into it. So we aren't just simply saying, here you go. We have a training program that we're developing, and that should be available for docs to participate in if they're interested. And it's really not just how do you do dry eye, it's how do you build an Eyewell-like entity. But more importantly, we'd like to have Eyewell centers in multiple cities across the U.S., maybe London as well. So I would say best thing to do is reach out to us and have a conversation.
Hey family, if you enjoyed this full podcast, don't miss out on more engaging content. Check out the next episode right here. And for the latest updates, hit that subscribe button and ring the notification bell. Your support means the world to us. Catch us in the next episode. Peace.